Hello, everyone. My name is Joy Mikil. I'm the Senior Program Officer with Refugee Welcome Collective. I want to first welcome you to the Refugee Welcome Collective Lunch and Learn series. In these sessions, we aim to bring you interesting and timely information. Whether you are a volunteer, community sponsor, resettlement agency staff, or a local advocate, or just someone who's interested in learning more, we hope that you enjoyed today's session, Child Abuse Prevention Awareness. Just a little bit about us. Refugee Welcome Collective collaborates with partners to provide in-depth training programs, weekly learning sessions like Lunch and Learns, resources, on-demand technical assistance for sponsors, resettlement agency staff, refugees paired with sponsors, community and institutional partners, and others to support the quality of community sponsorship programs across the United States. Just for housekeeping, as a reminder for everyone who is joining us today, everyone on today's webinar is going to be automatically muted. However, if you have any technical issues, please send your question on the question box so we can assist you. If you have any questions about the webinar itself during the webinar, please drop your question in the chat. And just again, a reminder that we are going to have a time for Q&A toward the end of our webinar. Additionally, the presentation, any resources, and a recording of today's webinar is going to be sent out to everyone following the webinar. And this brings us to our presenters for today. I'm going to give it to Julie to start the introduction.
Hi, everyone. Very great to be here. My name is Julie Golston. I'm the Senior Program Officer, Family Safety Technical Assistance for CWS.
Hello, everybody. I'm Rosario Noah, the Deputy Director for Client Services with the Home Study and Post-Release Services Program.
Hi, everyone. I'm Auxiliadora Alvarado, AUSI for short, and I am the Senior Protection Specialist within the Technical Unit in CWS. So it's great to have you all here in this time.
Yeah, so today we are gonna, explore the key elements of comprehensive child protection policy, which leads to creating a safe and nurturing environment for children and their families. We are gonna reflect on best practices and strategies for prevention, recognizing and addressing child abuse, early intervention, and in supporting safe and nurturing environments for vulnerable children. Next slide. So, Child Abuse Prevention Month is observed every April in the United States. It has a long history that underscores its crucial role in raising awareness and mobilizing efforts to protect children from abuse and neglect. Child Abuse Prevention Month traces its roots back to the early 1980s. Advocates and professionals in the child welfare field championed this idea, recognizing the need for an increased awareness and also further prevention strategies regarding child abuse and neglect. In 1983, the U.S. Congress officially recognized April as National Child Abuse Prevention Month. This federal acknowledgement was crucial for mobilizing nationwide awareness and further action. So, as many of you probably have seen, is the Blue Ribbon campaign. So, the symbol of Child Abuse Prevention Month is the blue ribbon. The blue ribbon, as a symbol for child abuse prevention, was initiated by a woman called Bonnie Finney. She was a grandmother in Virginia. Finney tied a blue ribbon to the antenna of her car as a way to remember her late grandson and to make people aware of the devastating effect of child abuse. Her personal story and the use of the blue ribbon sparked a nationwide wide awareness campaign. And so today we use this blue ribbon, and it has been chosen to represent the bruises and the battered bodies of the victims, serving as a constant reminder of the need for us to continue to fight against child abuse.
Thank you, Julie, for framing this presentation that what we aim to continue the awareness around child abuse and child protection. So we have organized our presentation and our sessions today in 2 sections. So the first part is like a reflection on what does it mean to be a safe organization. And this is for all type of organizations. We can be a volunteer organization, we can be a church, we can be an organization that is providing services for refugees. So what does it mean to be a child safe organization, and especially for children? So next slide, please. So being a safe organization means at least to have in mind 2 main principles. The first one is a do no harm principle. And this principle refers to organizations' responsibility to do not do harm or minimize the harm that we might do inadvertently just by being present. So it's having present that just us by doing an intervention, just us by working with families, by working in communities, and by working with children, we can produce harm. So it's having in mind, like with every activity that we do, and ask ourselves, can this activity that I'm promoting provoke some harm? Even if we're trying to do some good actions, we can provoke some harm. So it's having in mind the principle of do not doing harm. A way of doing this is understanding the risks that people we are working or we are serving, we can produce. So it's understanding that what risk am I increasing the risk of the children and the families we are working with? As a volunteer, am I increasing the risk? Me as a staff, are the activities that I'm promoting are increasing the risk that this family or children are already facing? So it's asking those simple questions about, am I doing harm or am I increasing the risk? A way of being a safe organization, a safe volunteer, or safe staff when working with families and children. Some practical actions to do this is by having safeguarding policies and procedures, by having trainings and how to be safe, by having code of conducts and telling our volunteers and telling our staff or organizations what behaviors are not allowed, especially when working with children, and what behaviors are promoted when working with children. And also having like referral pathways to report concerns. It's important that everybody knows what to do if we find out that a child, a concern related to a child, and we need where to report it, how to report it, or who to communicate this information to. So these are like some minimal principles and questions that we need to ask as organization and as a volunteers and staff to be a child safe organization. Next slide, please. Thank you. So this is just to summarize what we have said. To be a safe organization for children, we need to understand our role as an organization, our role as a staff, our role as a volunteer. We need to understand the risk, and we need to address those risks. We need to have policies, procedures, code of conducts, and ways to report any concern that we have regarding child safety. And we also have to have trainings and have learning session. We have to have people that we can ask information if we have a doubt related with a child concern. And everything has to be founded by the principle of do no harm principle. And later on, we're going to go a little bit more in depth on what does this mean like in practical. Next, please. So about understanding and addressing another important area that we need to reflect when we are working with families and especially with children is, in order to really have a meaningful access to services, we need to understand any barriers that they could face. So sometimes we are providing services to the family, but children may face some specific barriers because they are children. So it is important to us ask to ourselves to ask when we're working with the family, what are some barriers that these children could be facing to access our service? Because at the end, what we want is to have programs that are safe and also the programs that are promoting the best outcome possible for the child. So some of the barriers that children and families could face are physical barriers, informational barriers. So if the information is child friendly, is the information written in a way that the children can understand it? So it's not only important to have information like a package that sometimes we have for the family, but we also have to have some of those information available for children in a way that children can understand it. And it's also important to understand social barriers, stigma, and shame that they could be facing, psychological barriers like fear and anxiety, cultural norms, and others. And it is important not just to understand the barriers, but it is also important to address those barriers. And some ways of doing that is by having mapping and addressing the barriers, having a community engagement, participation, and empower. The more we include the community, the more we're gonna work towards those barriers. Having cultural humility and having accessible and reasonable accommodations, and also being having present gender norm transformation that it sometimes can limit children's access to some of the services. Next one. Other important area about being a child-safe organization is having ways to collect feedback, and not just to collect feedback from the family and the community, but also for children. So it's having mechanisms in place to listen to the voices of children and listen if children are feeling safe with our actions, if children are having access and to the services that we're trying to promote, if we are engaging with children in a child-centered way or a child-friendly way. So it's having mechanisms in place where children can provide feedback, and this feedback can be feedbacks that can help us improve as an organization or as volunteers or our staff. Also feedback where they can report concerns when they have a concern about probably a behavior or an action that we are doing as an organization that does not make them feel safe. So it's important to have open channels for children so they can provide feedback. So next one. As an organization, we have put together a child safeguarding policy. We have been having one for a couple of years, but we just recently updated, and all of these principles and others are integrated in these policies. So as I mentioned, a policy and having not just the policy, but procedures and implementation plans to implement the policy is important to keep children safe. So as an organization, we understand that having a safe culture is important for children. We recognize that any action that we make and put children in risk, and if we fail our duty of care, there are long-term effects for children, their families, and the community, and even the organization. So we have established this child safeguarding policy where all our organizational expectations are there and all the requirements of behavior and conduct are there. So everybody has a clarity of what is expected and what to do and where to go in case we have a child protection concern, and how to not just report it, but who to go and how to be informed and trained about that. So our child safeguarding policy, it includes all of CWS staff, full-time, part-time, temporary, permanent, and other, and also include volunteers, board members, and all our partners, consultants, and all our program partner implementers too. So it has a big scope, and we're just presenting this as an example of one way that we can keep promoting safety in our programs by being a child safe organization and by having a policy and follow up that policy. So CWS policy is grounded under some principles, and these principles are prevention. How do we prevent child abuse in our programs, and how are we a safe organization, awareness and education, safe programming, and how do we report and respond to any concern related with child protection. Next one, and our child safeguarding policy also considers some local definitions in the US. Our child safeguarding applies for the US and also for some of our international programs, but is also grounded in core definitions of child abuse and neglect, and also standards for reporting. So we are using the definition that we have in the CAPTA Act. Well, child abuse is defined as any reason or act or failure to act on the part of parent or caregiver that result in the death, serious physical or emotional harm, sexual abuse or exploitation, or any act of failure to act that present an imminent risk of serious harm for children. And we also understand the importance that everybody knows what are the standards for reporting, and this is integrated as part of the policies. As we mentioned at the beginning, being a safe organization, it's understanding our role as an organization, but also like every staff and every volunteer also understands their role in keeping children safe. So this was part one, just to understand like how as an organization and staff and volunteer we can also play a part to keeping children safe from different forms of harms and also abuse. And now we're gonna go like more in depth and more the programmatic way. How do we early detect, prevent, and respond to child abuse? Next, thank you.
Thank you so much, Roxy. So yeah, we're gonna go to part 2 now, and we're gonna look into more prevention, recognition, and also how we address child abuse, early intervention, and supporting safe and nurturing environments for vulnerable children. So let's go to the next slide. And so, just as was mentioned a little while ago in regards to the no harm principle, so how is that relevant to us? And the no harm principle is a fundamental element when we face cases involving child abuse. It guides us to act with ethical responsibility, ensuring that our interventions are thoughtful, culturally informed, and also have a primary focus on the safety and well-being of the children and the family that we serve. Cultural sensitivity and awareness. So, you know, in our roles, we encounter families from various cultural backgrounds. Understanding and respecting these differences is vital to accurately, you know, assessing and addressing child welfare concern. The no harm principle compels us to approach these situations with informed sensitivity, and also ensures that we do not misinterpret cultural practices as abusive, and we also avoid causing distress and further, you know, like alienation among the families that we do serve. And next, building trust. You know, it's fundamental to our work. So by demonstrating that our primary concern is the well-being and safety of children and not a punitive action, we can encourage more open communication. Trust ensures that family feels secure in seeking help and also engaging with our service, knowing that we are here to support and not to judge or penalize. Trauma-informed approach. Many refugees have faced significant trauma. Recognizing signs of child abuse within this context mean being mindful of how trauma affect behavior and also interaction. Our commitment to doing no harm require us to tailor our approach to minimize the risk of re-traumatization, ensuring that our intervention are sensitive to past experiences and also current vulnerabilities. Next, it's important that we also consider ensuring that our intervention is always appropriate. When abuse is suspected, our intervention must be carefully considered. This involves coordinating with culturally competent professionals, utilizing interpreters who are sensitive to the nature of the family's language and also culture, while providing support that upholds the family's integrity. Every step must balance the urgent need to protect the child with the imperative to do no further harm. And finally, we are going to look at advocacy for protective policies. It is our responsibility to advocate for policies that protect and support children and the family that we serve. This includes pushing for adequate resources, support service, and legal protection that enable the families to adjust and thrive in their new environment. And this should always be without fear. Through advocacy, we ensure that our actions are backed by a framework that truly adheres to the no harm principle. Next slide. So we are going to look a little bit into how domestic violence do affect children. It's one of these major components that have a really tremendously long-term effect. And so children who witness domestic violence are more likely to experience emotional, behavioral, and psychological problems compared to their peers who have not witnessed such violence. Some of the effects seen in children who witness domestic violence is an increase in fear, aggression, anxiety, depression, PTSD symptoms, and problems with social development. Children exposed to domestic violence are at far greater risk of developing emotional disorder and also engaging in violent relationship as adults. Studies show that witnessing violence has similar impact on children's psychological health as being directly abused. Exposure to domestic violence is associated with poor academic performance and also cognitive difficulties. Witnessing violence disrupt normative emotional development and may lead to long-term emotional distress and relationship problems. Children exposed to domestic violence need targeted intervention and support to mitigate both immediate and future harm. And now we're going on to the next slide, and it is Rosario.
All right, so thank you, Outsi, and thank you, Julie, for taking us from the organizational view and the no harm principle, the child safeguarding policy, to the most practical aspects of what we can do to support child abuse prevention. I would love to hear from you, if you are comfortable, and I'm referring to the participants, if in your experience, and please feel free to put a comment on the chat, in your experience working with families and children at any point in the past, there was a moment where you felt that there may have been some indications, some signs, or you suspected child abuse or neglect. If anybody wants to answer that, please, you can say yes, no, so that I have an idea if this is something that maybe you experienced in the past. As you may get ready to answer that on the chat or not, I want to take you basically to some elements that we wanted to present today as to what is it that they are that we consider and that we want to propose to you as best practices and strategies for preventing child abuse and neglect. And the first one that we wanted to mention is early intervention. And basically early intervention means putting in place a system of services and support as early as possible. So that means I'm working with a family. I will give you an example. I'm working with a family, and there is a pregnant woman. Early intervention means I'm going to make sure that that individual has the support system and the services that they need for that pregnancy as soon as possible. And then that applies to a child, that applies to any individual. Any situation, any risk, any need that we identify in that household, that we put in place and that we work to referring them so that they have the services and the support that they need as soon as possible. Now, we're working with the family, and the family tells me, I hear, I identify, they report what are some of the things that they need, that they're worried about, what are the concerns, what are the risk factors, and our approach will be in terms of preventing child abuse and neglect. We want to always have a strength-based approach. And what is it that means? I will put in place and I will utilize all the good characteristics, all the positive elements that I know and that family tells me that surrounds them. And I want to introduce the term of protective factor, and basically what is it that means? A protective factor is any positive characteristic or a condition that someone may have and that contributes to promote resilience and to reduce the likelihood of a negative outcome. So as long as I'm working with that family and communicating with them, I will make sure that I am educating them, or I am identifying the protective factors so that these conditions and these characteristics can be utilized to mitigate the concerns that the family is reporting to me. Protective factors vary, and they may be identified at different levels. We could identify protective factors at the individual level, at the family level, community level. I also want to make sure that we know that what may be a protective factors for one individual, not necessarily it is for another individual, so that we can recognize the difference and how is it that it really may be a protective factor for that case that we're specifically working with. Depending on the situation, safety planning is necessary a lot of the times, and it is a first step so that we can help the family cope with specific situations. Safety planning is usually implemented when the family tells me about a concern on a situation, and safety planning is completed in collaboration with that family or with that child regarding that specific concern. And basically it gives them concrete and a specific task of something that they can do in an unsafe situation to achieve the safety. I also wanted to briefly highlight the difference between discipline and abuse. And it is for you all to keep this in mind, because sometimes the family may, or the child may report a specific information, and we may be wondering, is that a physical discipline, a strategy from that parent or from that caregiver, or that may be an abuse? Basically, when a physical or a discipline method may be excessive towards that child, that may be considered abuse. The statutes vary in each state, and a recommendation for you all is that you are familiar with the state statutes in the areas where you work, where you provide services, so that you may know the difference between discipline and abuse. But in most cases, when that discipline is excessive, it may be considered child abuse, and that is reportable. And then the last factor that I wanted to highlight as best practice and a strategy for prevention is that we are always understanding of the relevance and the importance of providing education and psychoeducation to the families. Education about what are their rights. And I'm talking about the child, so having a conversation with the child and telling the child what are your rights? If we're talking or referring or serving an immigrant child that comes from another country, is not familiar with the US laws, and this applies to the child, the caregiver, and the family that the child may be living with, it is essential that we provide education to them, and obviously psychoeducation about the specific needs of that child. And I can talk a little bit more as we move into the best practices and strategies for intervention. We can go to the next slide, please. All right, so this is really important. I know that we're providing a lot of information today, but this is one that I really want to highlight. And if we are to walk away with 3-4 aspects, let's walk away with this one. Living in poverty, and I will give you, or I'm giving you some specific examples: food insecurity, housing insecurity, any other environmental concern related to the socioeconomic status of that child and or the family is not considered child abuse or neglect. Our job as social service providers is that we must exhaust interventions to connect the families, to connect that child, that parent, that family in general, to the services that they need or the remedial resources that they need to access the support and the services that they have. Now, if after we have exhausted all those interventions, a caregiver fails to access the services repeatedly, and that may lead to placing the child's health or safety at risk, then perhaps that require intervention from Child Protective Services, and we may need to follow up. The next slide, please. So let's go to specifically addressing child abuse. We, again, a little bit of a recap and connecting the ideas from organizational view to the no harm principle and some practical aspects. We talked about some indications of what could be child abuse, what is the definition of child abuse. Now, how do we address child abuse in a specific situation? I wanted to talk about confidentiality. Depending of your role, depending of what you do in the program that you represent and that you interact with the families, you may be required to discuss confidentiality as you begin the relationship with that child and or the family. It is really important that in that introduction to the service and to yourself and how is it that you're going to be supporting or providing services to that family, that you discuss confidentiality, that you explain what it means, and that you explain the limits and the exceptions of confidentiality. Why this is so important? We talked about mandated reporting, and we know that if we have suspicions of child abuse, the majority of us are mandated reporters, and we have to report the situation to child abuse to Child Protective Services for them to intervene. So if we explain the confidentiality, the exceptions to the confidentiality and the limits to confidentiality since the beginning, the family will know what you have to do in specific situations, and that definitely helps to preserve the relationship that you have with them, even after you have to continue working with the family if you are mandated to make a report of an abuse or suspected abuse situation. So yes, confidentiality, the relationship has begun. I have taken care of that. My job in working with the family, we have a specific goals, depending programming, depending what you do, right? In my relationship with that family and in my effort to prevent child abuse, I will be assessing the situation in an ongoing basis. We identify the concern, we identify the risk, and then we provide the support that is needed to mitigate those concerns. I say that we do this in an ongoing basis, and I wanted to highlight that reporting or disclosing child abuse or any form of abuse, Julie talked to us about domestic violence. This is not something that a person is going to come to you and report it to you the first time that you meet with them. For the most part, someone who is experiencing abuse is living under extreme fear, and these individuals lack trust. So it takes a lot of time to build that trust from the provider, from all of us, and to make sure that that person may be ready at some point to disclose the abuse or the situation that they may be experiencing. And that's why it's so important that our assessment goes in an ongoing basis in every communication, in every conversation that we have with the child from beginning to the end, that we are constantly making that assessment and working towards building that trust. If we identify signs, if we have indications of the child, suspected child abuse or neglect, and what is it that means, I also wanted to make sure that we know the difference between knowing who may be the potential perpetrator for that potential child abusive situation. If the person is a caregiver or has a caregiving role towards the child, or a position of trust and power, then that may be a child abuse situation. But if it's a non-caregiver or someone that doesn't have that position of trust or power, then the intervention may be warranted by another entity and not Child Protective Services. So knowing the difference as well is really important because it determines what will be the intervention and what will be your follow-up in supporting that family, in supporting that child. Quickly, suspected child abuse. That means if we have identified signs or indications that the minor or the child may be experiencing child abuse or neglect, we are mandated reporters, we're gonna make that report. We're not investigators. It's not our job to submit that child to a thorough interview to get details. We don't do that. That's not our job. We follow up with the corresponding authority, who is Child Protective Investigators in the state where you work. They do the investigation, and then we provide the support to the child. Other considerations quickly, there may be situations about child-on-child abuse. I wanted to highlight the elements of medical neglect, educational neglect, and consultations. So knowing when you may be in a situation of medical educational neglect, we want to be familiar with state educational laws, and we want to make sure that we utilize the concept of supporting the family and exhausting all the interventions so that the family can connect the child to the educational services and to the medical services before we determine this child is experiencing educational neglect or medical neglect and we need to follow up. That will be the last resource. The first resource is exhausting interventions to connect them to the services that they need. And then consultation, a lot of the states offer this, and that's when you have like a very difficult situation. There is a gray line and not certain if this is maybe reportable. You can contact the hotline. You may provide a description of the situation that you have identified and ask them if this is something that you will take for an investigation. If they say yes, then they take the child's information and the family's information demographic, but otherwise they will tell you, no, this is not reportable, and they may even tell you what will be a best practice or something that you need to do to support that family in that situation. And the next slide, please. So now, quickly, we want to mention some of the best practices and strategies for intervention. And this is once we are working with a family, we may have already identified suspected child abuse or neglect. We may have already completed that report to Child Protective Services or not. Maybe not, but as I'm intervening, as I'm working with the family, we want to make sure that we know that we recognize the impact of trauma. Trauma affects individuals in different ways, and a child's behavior is always a reflection of what that child may have experienced in the past. So understanding that is key so that I can provide services to that family in a trauma-informed way. Once I have the family, I know that they're my client. It could be, again, the family or the child, is making sure that we are maintaining regular engagements with the child, with the family, If your program allows for in-person meetings, that is best practice so that you have the possibility to build that trust and to do those assessments in person. You want to meet with the child privately if the situation allows for that. You want to meet with the caregiver privately if the situation allows for that. And you want to meet with them as a family so that you can assess family dynamics as well. Doing the ongoing assessment for safety, identifying what are the stressors, what are the concerns for the family as soon as I begin working with them. And then checking on those little elements, depending on when in the life of the family you come to work with them, but how are they adjusting to the situation that brought them to services in first place? How is the child adjusting to the school? How is the child adjusting to divorce? Depending, again, what is your interaction with the family, always checking on the adjustment to any life change or any new situation for them. Assessing the risk and the protective factors, and then the assessment of the family dynamics. Julie gave us a really good overview about intimate partner violence, domestic violence, what that means, recognizing other aspects that may be related to the family dynamics, such as exploitation concerns, lack of supervision in the home, etc. And let's go to the next slide, please. Interpretation, we work with families that speak other languages a lot of the time, so making sure that we are communicating with the family in the language that they understand and that they're able to express themselves and that they can also understand the information that we are providing. Service plan, if this is something that you do in your role, making sure that we're listening. The service plan is something that we complete, attending to programmatic goals, but in first place, we need to attend to their wants and their needs. Obviously, that they may be relevant to your program, relevant to the job that you're doing, but making sure that they participate in that service planning process, ensuring their connection to the services that they need, advocating and working to address any barrier to those services. During the lifetime that we work with families, a lot of the times, crisis present. So knowing what to do and how to intervene in crisis situations, putting the safety plan in place is really important as well. And something that I have it here as the last point in this slide, but not the least, is giving the care and attention to staff wellness. Working with children and families, with vulnerable children and families, could be very stressful. So we have to be very understanding, and we have to respond to compassion fatigue, burned out, vicarious trauma, and secondary traumatic stress. And all of this alone is reason for one training, but we also wanted to bring your attention to this, making sure that you have self-care in place and that you are attending to your needs so that you can attend to the needs of the families that you provide support to. Next slide, please. Alrighty, last slide for best practices and intervention is education. That we know that we are educating the families about school enrollment, what are the rights, what are the education laws in the state where I work, compulsory school age in the state where the family is located, and that they know and understand the services that the school system provides for them. Educating the family as well about child abuse and neglect laws, about labor laws, and educating the child about their rights and the caregiver responsibilities, and educating the caregivers about their responsibilities towards the child. We also educate them about what are the available services in the community, what are the places that they can go to attend to their needs, and educating them about the legal process is really important. What are the implications of not following through with the legal process as well? Providing a specific psychoeducation that is tailored to the child's needs and that addresses the impact of trauma, family loss, separation, adjustment, and very important is preparing the family for independence. We work with the families for limited times, but the ultimate goal is they're ready and they know what to do when I'm not longer supporting them and providing the service that I'm providing to them. Next slide. Okay, so some final elements for you all so that you can kind of like have a little bit of what are the highlights of this conversation that we have had. Work to establish trust is of essence. Abused children or families or children who have experienced trauma, they need support to heal, and they need someone who trusts them so that they can heal from that trauma, from that experience. So keep that in mind, please, as you come in contact with children and families and supporting them with their needs. Keeping or maintaining trauma-informed, child-centric, and strength-based supportive approaches is really important. And that highlights the no harm principle that we have described to you all today. Following the mandated reporting guidelines, applying the interventions or the strategies of advocacy, outreach, and collaboration so that we can put all the services in place for that family, for that child. Knowing compulsory school age and statutory rape laws in the state where you work or where you provide the service to that child. Understanding trafficking and or exploitation concerns, and what do we do when we have any red flags or any indications of that. And then obviously, lastly, having in consideration any special vulnerability for that child, mental health, any special needs, developmental stages, and cultural consideration. Depending on each one of these aspects, we adjust the interventions and we adjust the conversations and how is it that we support the family to attend to those specific situations. Next slide, please. Resources. So we wanted to give you, these are 3 books that are free right now in recognition of April being Child Abuse Prevention Month. These 3 books have received a grant, and if you're interested in getting any of them, you can email the person on this slide. You will get a free copy of the book. Any book that you're interested, you can just name the book and request it. And then in the next slide, we have some other resources that we recommend if you have time to explore further. The first 3 or any that you may find in the Child Welfare Information Gateway, you can find state statutes on child abuse and neglect. You can find websites for the specific agencies in each one of the states and where to report child abuse. You can find the difference between disciplines and child abuse as well, and a whole lot of great information. And then you have these other resources that we wanted to make sure that they're available for you review if you have time to do. And I think this is our last slide. I wanted to say thank you and just pass it on to Joy and see if we have any Q&A.
Yes, thank you so much, team. That was such a great presentation. And now this is a time for us to answer the questions that you have submitted in the chat. If you submitted questions, as a reminder, you can still submit any questions that you have through the chat, or you can come off mute and ask any question that you might have. So please make sure this time is being used well and come off mute, ask your questions. We have 3 experts who would love to answer your questions. To kick us off, I have a question. So let's say I am a volunteer and I come to a family and I suspect there might be some abuse in this family. I don't have a disclaimer with the family from the beginning. Since I'm a volunteer, I didn't have this agreement with them. What should be my next step as a volunteer that might be still with an organization, with a resettlement agency, or might be continuing to support this family after the 3 months of resettlement?
That's a great question. And I'll see, Julie, we didn't talk about who is going to take questions, so I don't know if...
If you want to start, and I can complement if needed, or I start and you complement, whichever.
You want to do that?
I
Or-
start, then you complement. Perfect. Yeah.
Thank you.
So in CWS policies, at least, we volunteers, and I think in most organizational policies, volunteers might have like the same some of the same responsibilities when reporting child safeguarding situation or concerns or child protection concerns. So if you have a doubt about what to do, the volunteer should come to like the manager or supervisor who is he working with, and they will guide them through the process that they should follow. But and most of the policies and programs, volunteers, if you are working with the family and with children, you might have like the same role and responsibilities, at least in reporting, like a staff member will have. But if you have doubts, so the first thing you can go to the person you are working with. Rosario, you want to go connected with the child welfare system?
Absolutely, absolutely, Outsi. You said it well, and basically, essentially, if you're uncertain about what to do in that specific situation, we always say come back to the representative from CWS, the person that you work with, how you're connected to that child or to that family, report the information, and the proper follow-up will be following up with Child Protective Authority in the state where you work. If it's not directly through you, maybe through the staff representative that is communicating with you. But also, that highlights the importance of being familiar with the state statutes where you are located, where you're servicing that family, because for a lot of the states, most of the individuals that come across a situation of suspected child abuse are identified as mandated reporters as well. So independently of what the organization may require from you to do, the state may also require from you to do this report. So thank you. Great question. Thank you so much. I hope that in the way that we answer is helpful, but if there is any remaining aspect that you want us to review, let us know. Julie, you want to add anything else?
Yeah, I just wanted to add, that anyone standing in that particular situation, always remember that there is support out there. I know it can be really, really scary. So, also make sure that you take care of yourself in that situation and try your very best just to remain as calm as possible. And, make sure that the person that you are speaking to, that it's in a confidential space, so that your safety is not being jeopardized in that situation. But, first and foremost, just really remember that you are not just by yourself out there, there are support. And so, just try to stay as calm as possible and just seek the support that you need in that situation. And someone will be there to support you.
Thank you so much. I see there is a question here in the chat. It says, if I'm not sure if something is considered abuse or neglect to a child, is there a different number to call, or would it be the same phone number as the child abuse hotline?
So always you will have, if you're not certain about the situation meeting the criteria to be called in, we first recommend that you go to your supervisor. Or again, the person who is giving you that technical assistance, so that you could staff the situation and determine what is the most appropriate intervention for the situation. The majority of the programs, SOPs, may even have that as a mechanism so that we can make sure that we're calling in what we need to call in, but some situations don't need to be called in. And contacting Child Protective Services also has implications for the family. So we always have to keep that lens of, I want to be safe, I want to protect the child, but we also need to understand what are the implications of me making this call. So if we're calling it in, we want to make sure that it warrants that call and that we have exhausted all the interventions that we needed to exhaust prior to making that decision. So we definitely encourage that you staff the situation with your supervisor, the person that provides the technical assistance, and then you go on to that report. Some situations may be urgent, some situations may need urgent intervention, and it's clear, but in the majority of the cases, if we can, that we always have that opportunity for consultation and discussing it with a supervisor.
Yeah, and I just also wanted to add to that is that, sometimes it can be really hard to gauge what is actually going on, and also because it affects us emotional if we are witnessing something like child abuse or even having a suspicion about it. So, going and talking to someone about it also help you not have to just walk around wondering, was there really something going on? It's always great that if you're ever in doubt about it, always make sure that you reach out to a manager, supervisor, have that conversation. You should not be carrying that responsibility, and that also ensures the safety of that child. It never ever hurts to ask the questions. It's always better to ask one too many to your manager or, like your supervisor, because some of these signs might not always be very clear cut.
Thank you so much. Are there any more questions from our audience that you would like to ask before we move into our feedback? And as a comment, I think one thing that I was also thinking about during this webinar is, the importance of navigating things, asking the questions, making sure that, you understand the situation. There might be some cultural differences sometimes. What you might consider as neglect might not be as to that extent in terms of culture. So please do follow up with the case manager, measure and try to understand the situation before acting on it for the protection of the child and the family and for your protection as well. And now we would like to hear from you and receive any feedback on today's webinar and hear your suggestions for our future webinars. We take your recommendations seriously and we try to have some topics that are going to be most useful to you. So please do take a couple minutes just to scan this QR code or to go to the link for the feedback. We're also going to post a link from our presenters who would like also to get your feedback about the webinar. So they can also report it to CWS. So if you could please take a minute to fill out this survey, that would be very appreciated. We appreciate your participation in that. So we're just going to take a minute to do that, and then I'm going to bring us to our closing. Thanks again for our presenters today for such a great presentation. I really appreciate you being here and giving us this knowledge. And thank you everyone for attending today's RWC webinar, Lunch and Learn. And you will receive a follow-up email from me with a recording and any resources that the presenters have. I'll also include that in the email. Thank you again for joining us, and we wish you a great rest of your week.